I'm Dr. Andrew Sloan. I'm the Peter D. Crystal Chair of Neurosurgical Oncology at the Case Western Reserve School of Medicine and the Director of the Brain Tumor and Neuro-Oncology Program at University Hospital's Seidman Cancer Center. GBM is unfortunately one of the most deadly cancers known to man. The median survival historically has been roughly about a year. The standard of care for patients with GBM is maximal surgical resection followed by radiation and chemotherapy, typically with a drug known as temozolomide. Immunotherapy is a very promising treatment for cancer in general and gliomas in particular. One of the advantages of immunotherapy is that there's very little toxicity. It's typically much better tolerated than most of the toxicities that we see from most of the chemotherapies. DC-Vax is a dendritic cell vaccine, and it's one type of immunotherapy. So the way that works is the patient has surgery for the tumor, and then that tumor, after it goes to pathology to identify that it is in fact a GBM, is then processed into various types of proteins that are then combined with dendritic cells from the patient's own blood to create a vaccine. The idea is to enable the patient's own body to recognize these tumors as foreign and dangerous and then attack it. The DC-Vax trial has been going on for a little over 8 years. It's a relatively small trial, but the results have been very promising so far. Median survival's about 3 years, and there have been a small number of survivors at 4, 6, and even 8 years out. We're hoping that we can reproduce the preliminary data and get lots of patients surviving much longer with very little toxicity. Very exciting study, and we're excited about it.